Public health is a commitment to people thriving in all aspects of their life. It's meeting people in their community, in their homes, in their schools, and asking the questions, what are the barriers to optimal wellness for this person, this family, this community?
Decades of research and the evidence shows us that what happens in the early years of life for children and their families sets the trajectory for the rest of their life. The National Nurse-Led Care Consortium serves about 800 families a year and is the largest provider of home visiting services in Philadelphia. Home visiting services are proven to support family economic self-sufficiency, and furthermore, they build communities. They empower families to see themselves as part of a larger structure. NNCC started the Nurse Family Partnership, and that program is for first-time parents from pregnancy until their child turns 2 years old. So we're looking at folks learning to become a parent, a nurse walking alongside them to welcome them into that world of parenting.
I think one of the most important qualities as a nurse home visitor is humility and cultural humility, and to be able to come into a home very lightly. It's part of the NFP model to start ideally before 28 weeks of pregnancy. And I think it's that strong rapport and relationship that we build during pregnancy that allows us to make that sort of delicate transition once the baby's here to provide that postpartum support.
Mabel Morris is a program that is a curriculum under the parents as teachers. That program supports parents to understand that they are the first teachers and they are the most important teachers.
We see families growing and furthering those goals that they began in Nurse Family Partnership and sort of nurturing that into the school years with the family and bridging that connection to the classroom, whether it's preschool or kindergarten, and helping families and children prepare for that.
Our model says that only a small change is necessary. And that's so true. Because if you see the whole picture, you may see like, oh, this is not working. But if you see where the family were before, then you're like, oh, that's a big change.
We're an evidence-based program, which means people are constantly gathering data on who we're dealing with, what we're doing, keeping in mind what's going on all around the world and how different things affect us, whether it's climate change or a pandemic.
Something that I really love about NNCC is the dedication to recognize the needs of our families and to build in additional layers of support. And I think when you take a systemic approach to treating the issues, it allows for home visitors to give better guidance to their families and to lean on additional resources in a way that doesn't end up sacrificing that trusting relationship between the home visitor and the family. NNCC is contributing to Philadelphia becoming a better city for how it treats its families. And I think that Philadelphia really has the opportunity to become a leader in serving and supporting families rather than policing them. And I think that's the direction that NNCC is helping the city move.
This work is not just about the present. It's about my children. It's about the children in the community that I live in. It's about the future. I believe that maternal child health home visiting is important to supporting families and giving parents their voice. I believe when parents thrive, entire communities thrive.